Now, what if my physician thinks, no, my symptoms are due to my gallbladder, either because of small stones, either because of the stones, regardless of the size of them. So what are my options? Well, nowadays we have two options. One is medication, and those we tend to reserve for patients who have very mild symptoms and have very small stones. The main problem with gallstones is that we actually do not want them to leave the gallbladder. They are unlike kidney stones, whereas in kidney stones, we try to break them up and actually want them to be flushed from your kidneys. It is actually completely the other way around for gallbladder. You remember I said gallstones cause problems when they occlude or obstruct or block your drainage system. That is the biliary drainage system. So that's the drainage system from the liver after it makes its bile and it's trying to get that bile that it made into the intestine. That is when problems arise. So we don't actually want to necessarily allow these stones to empty through the drainage system into and block the bile duct systems. Therefore, and a lot of times, these medications, we tend to use them as a prevention to developing gallstones or symptomatic gallstones, and especially in patients who we know are going to have significant weight loss, such as patients undergoing bariatric or metabolic procedures. So that's one option. However, the other very common and fairly prevalent option is to perform minimally invasive gallbladder removal, which is cholecystectomy. Whether that is laparoscopically or robotically, it is a fairly safe procedure to perform, and the risks associated with it are extremely low nowadays. The more experienced your surgeon is, obviously, the lower the risks of developing any of these complications. Generally, it is a same-day surgery after making 3 or 4 small incisions, and the patient would get general anesthesia, and we discharge on the same day. So common questions after having gallbladder surgery. Can I live without my gallbladder? Short answer, yes, you can. Remember we said it's the liver that produces the bile, and therefore your liver will adjust and adapt, and it will continue producing bile normally, but it will actually adjust its rate and the amount it releases into the digestive system. Generally, it is not unusual if you introduce fatty meals too early into your diet, and that usually is before the 4-week mark, you may have a little bit of diarrhea because of increased fatty burden in the intestine, and therefore the bile may not be able to absorb the fat in timely fashion. And generally, it will adapt and adjust after about 6 weeks' time. So you will actually adapt to the increased amount of fat that is required from the bile to digest over about a 6-week period of time. Recovery period. Recovery will take about 1 to 2 weeks to recover from surgery. So generally what we call some gas pain, which essentially is because of insufflation and putting the CO2 gas in the abdominal cavity. Even though all that gas is actually evacuated at the end of the case, what happens is your body, and depending on the person, some people are more sensitive to it, will develop this kind of like discomfort and nagging pain. A lot of times actually left or right shoulder pain that people complain of. That again will resolve over a period of time in about 1 to 2 weeks. So if you have a very physically demanding job, probably 2 weeks would be the time that you need to return to work. But if you have a more sedentary and less physically demanding job, you could be back to work within 3 to 5 days. If you have had open surgery, which usually it means either an incision, a straight up and down incision, which is about 5 to 6 inches, or under the right rib cage, then you'll require a long period of time to recover from that. And generally that's about 4 to 6 weeks time that you would need to recover from an open gallbladder procedure. Diet after surgery. So the diet after surgery, you should stay on low-fat diet for at least 2 weeks after the procedure, and then slowly introduce one meal at a time that may have a little bit of increased amount of fat. Generally speaking, we should be on a fairly moderate amount of fat diet and not high-fat diet However, if you're absolutely dying for those fries and you want to have a few fries, we recommend that you only have literally a few of those, because it may lead to diarrhea if you introduce fatty meals too soon. If you introduce, say, dark meats, because they can have a lot of fat, or fried meats, then they too will have quite a bit of fat, and that could lead to diarrhea. Most people will actually start tolerating these after 4 to 6 weeks' time with no symptoms of bloating or diarrhea.